Good afternoon, everyone, and welcome to another episode of the Neoliberal Round. This episode promises to be exciting. Actually, let me tell you, there is so many things happening that we can pick, choose, and refuse. So many things that we can talk about. We are still talking about COVID. Okay, COVID is still an issue because if you guys are not aware, there is, and of course, everyone should be aware of the Delta variant that is increasing and it's infecting everyone. Those who are vaccinated and those who are not vaccinated, but yet what we see happening is that administrators are requiring the persons to show proof of vaccination in order to get certain access. We want to deal with that today because that sounds ridiculous and nonsensical, okay? Because that as a way of forcing people to get vaccinated because they say it offers a layer of protection. What protection? When vaccinated people are just as likely to transmit the virus as unvaccinated people. It would seem as if we are playing God or playing their parents. Persons had the right, in America, had always had the right to choose whether or not to be vaccinated. Okay? But here it is that people who do not have a clue about anything and what's happening. Because actually I have a bombshell to give you today. But before I talk, there's also the Olympics, and we know the big story what's happening with Simone Biles withdrawing from several tournaments, and we want to talk about Simone Biles because I guess maybe I made the mistake of exercising my free will to provide an opinion, and I have been attacked from all quarters. Right, left, when I mean all quarters, biological and non-biological, from the left and from the right, okay? Persons who feel strongly about Simone Biles. And I want to share that, but I won't use this episode to talk about the Olympics. I am going to use the episode after this to talk about the Olympics. But there is and there is another issue that I need to raise. I was involved in a deep discussion on LinkedIn with Ray Dalio, and I want to talk, and I want to, so there are three foregoing issues that I want to lift up, that we could lift up today, and it's sensational, it's great, it's juicy, it's something that you want to journey with me on, but let us look at this issue of the COVID or COVID-19, and recently I got a letter from Georgetown University, and I want to share that with you, guys. Georgetown University. For those of us who are unaware, my name is Ronaldo McKenzie. I am the producer and the anchor here and the moderator of the Neoliberal Round, and I am also a doctoral candidate at Georgetown University, where I am reading for my Doctor of Liberal Studies, and I actually have classes coming up on the 25th of August. So I got a letter from Georgetown, and I am going to share from Georgetown University, from the dean. Here we are. It says it's from the SCS Office of the Dean. Know before you go, returning to campus on August 16, 2021. Their School of Continuing Studies students, SCS, were gearing up for a return to the 640 Massachusetts Avenue Northwest building on Monday, August 16th. We are looking forward to welcoming you all back with the utmost safety and health guidelines in place. With the COVID-19 vaccination requirement announced for all students, faculty, and staff, it is important that we take the necessary steps to ensure a seamless transition back. Students who do not fulfill the vaccine requirement will not be permitted to attend in-person classes enter campus building and will be withdrawn from classes. So I got that letter recently, and I was not happy with that. So I actually responded to the letter, and I'm going to share that response to you. I said to them, and I actually tweeted this as well. For those of us who do not follow me on Twitter, I have a Twitter page. It's at Ronaldo McKenzie. It's simply at Ronaldo McKenzie. So I tweeted this, and I also put it up on LinkedIn. Reverend Ronaldo C. McKenzie is my LinkedIn page, and it was also on my Facebook pages. But I responded to the letter. I said, vaccinated people, like the unvaccinated people, are just as likely to transmit the COVID virus. And this is not a conspiracy. It is a fact. In fact, if you follow the news, and the day when I wrote this, I was also watching CNN, and I was watching Wolf Blitzer. And on Wolf Blitzer's show, Wolf Blitzer also echoed this. And he had several medical officials who confirmed that. In fact, later on that same evening, who was it? I can't remember on CNN, another major anchor also echoed that there was a school where 4 out of 5 persons got COVID, and 4 out of 5 of them were, one of them was vaccinated. So I said, vaccinated people, like the unvaccinated people, are just as likely to transmit the COVID virus. So why are people, school admins, employers, and event organizers banning unvaccinated people from school, classes, and some private and public events? If anything, the unvaccinated people pose risks to themselves, not necessarily the vaccinated. So why are we acting as their parents by forcing them to do something, by applying draconian punitive measures as if it helps us, when it is for their own good? And if it is for their own good, then it is within their own right to take the necessary steps, not to be forced into a corner. They must accept the consequences of their actions, in that you stand the risk of maximizing the symptoms if you're not vaccinated. Now, that was what I wrote in my response on Friday of last week. But then, today, my nephew sent a message in a group text saying, and my nephew is in the military. He says he's about to, well, he's not in the military, actually. He's in the reserves, but I think he has to go somewhere, and he had to take a COVID test. And the COVID test revealed that he was positive for COVID-19. So then I said to myself, that should not be. When he said that, I said, what? Were you not vaccinated? And I asked him, what symptoms are you having? Sneezing, body aches, fever, stomach aches, nasal congestion and fatigue and the like. Now, this is exactly... Now, I responded to him. I said, interesting, that should not be happening. The vaccine was supposed to mask those symptoms. And I responded in the family group saying, this is exactly what I'm talking about. Why are people out there, officials, requiring people to get vaccinated when it is clearly not working the way they said it should? What's the use? Is it to satisfy feelings or costs? Was all this water and dead cells with protein that they gave us? This is ominous. In fact, I went further and I tweeted earlier today, because I am really incensed by this. I am really about what's happening in America. Okay, I'm really. I said a family member of mine was vaccinated early this year, now has COVID. And also the symptoms, sneezing, body aches, fever, stomach aches, nasal congestion and fatigue. Okay, fine. We know that the vaccine only provided 95% efficacy against infection. But it was supposed to mask or minimize these symptoms. that I'm hearing that people who are vaccinated are having the same kind of symptoms as if they were not vaccinated. Okay? So why are vaccinated people having the same symptoms as if they were never vaccinated? Yet restaurants, schools, and officials are requiring proof of vaccination in order to get access. For people to get access. So if you are not vaccinated, in many places today you cannot get access. This is quite ominous and ridiculous. It is ridiculous. If anything, people should be socially distancing themselves and wearing masks. I think that probably is the best and most effective until they can come up with some drug or vaccine or something that really works. Okay? Or encourage people to ensure that they have strong immune systems that can fight the disease. Yes? While socially distancing and masking themselves. And those who are vulnerable, you will tell them to not congregate. The same kind of policies and rules that we had previous to now, when COVID had created everything, had created a shutdown. So it is, and you wonder, and now it causes, and let me tell you, this is major. Because if, you know what, they're moving the goalposts now. You know what they're saying now? They are saying that, you are less likely. Less likely. It's not that you won't have the symptoms, no, we know. You're not supposed to have any symptoms. Okay, you weren't supposed to have the symptoms. It's supposed to be minimal. It's supposed to mask the symptoms. Now they're saying you're less likely. If you are not vaccinated, you're more likely. So now it's all a pop. We were never told. We were only told that it provides 95% protection against getting it, infection. Then we are told that it's supposed to mask. Now, when people who are vaccinated are getting the same symptoms and everything, now they're saying, well, it's less likely. You're less likely. Okay, that's what they're saying now. So but the issue is, it's not a matter of less likely. You are still likely. You're likely to you're still getting COVID. If you are vaccinated, you're still getting COVID. Okay, and if you're vaccinated, you're still getting the vaccine, just as if you're not vaccinated. So why are we requiring people and forcing people to show proof? In effect, what they're doing is telling that you must be vaccinated. When guess what? They are not even sure themselves. Okay? But they have to behave like this. Because we voted out Trump and got Biden because we thought, because he was better, because we thought that Trump wasn't dealing with it and all he had was conspiracy. Now you start to wonder, well, maybe it wasn't conspiracy. I'm telling you, this is major. Look what is going to happen. Because now the Republicans and people who thought that they were cool, people who thought that Trump was dumb and ridiculous, now you now start to wonder, and people don't want that. So you find that on CNN and MSNBC and so on and so forth. What are they talking about? And please just remember, I'm not Republican. I'm not the Democrat. Okay? All right? I am independent. Okay? I am in fact, I was one of those persons who was who had bought. Because first I was suspicious, then I bought the information that they presented. And now what we are seeing is it is a total collapse. A total collapse of this COVID strategy. A total collapse of the arguments that the Democrats and their scientists had presented. Okay? But guess what? What is going to happen is that they have no clue. They are not sure now. And what is the argument? This is going to affect the Democrats and their electability and anything else that they have to bring to people. I'm telling you. I am telling you this. Let me tell you guys this right now. In the next couple of days, there is going to be more people are going to get COVID. Yes, and the people who get COVID are going to be vaccinated and unvaccinated, and the people who are vaccinated are going to have the same symptoms. Some other people are vaccinated going to have this, and some people who get it who were not vaccinated, guess what? They will also have symptoms that is minimal, and some will have symptoms probably that is optimal, that is difficult. It is. Let me tell you, and the conversation now is going to be what? What Dr. Fox? What is Dr. Fox he's going to say? What is he going to say? What is the CNN and MSNBC and the Democrats going to say to challenge the Donald Trump and the Republicans and the conservatives, those who were against COVID and all these restrictions and requiring people? What are they? What's going to be? And it's also going to affect their ability, yes, to run effective campaigns that talks about their effective strategy of dealing with COVID, because COVID was a main political and a sticking point that helped, that affected the Republicans and Donald Trump re-election, and because we thought that he was not serious, but we thought Biden would be serious, and the message of Biden sounded better. But what is happening now? Exactly what Donald Trump was saying is happening. And guys, I'm telling you, you have to listen. In the next couple of days, watch what's going to happen. And I'm telling you this, and the neoliberal round is telling you this, but what is absolutely ridiculous, is doing the un-American thing, of requiring people to get vaccinated by using some kind of legislation and telling people, they have to show proof to get to restaurants and so on. I want to know what the argument is going to be. When that is not helping. It's clearly not helping. Guys, if you guys can send messages to feedback to the show. You can also you can follow us on the neoliberal.com, and send us feedback, send us a message, share, let others know about what we are doing. And just so you know, continue to access the book. It's available at Amazon, Barnes & Noble, Target, Kobo. It's in paperback, hardcover, ebook, and also the audio book. And we will be giving away free audiobooks. So if you're interested in getting a free promotional copy of our audiobook on the Audible, please send us a message, Ronaldo Mackenzie at theneoliberal.com. Thank you guys so much. Follow us, share our page with others, and see you in a few minutes where we will present another episode of the Neoliberal Round. It's a very busy day, very busy weekend. We have lots of other stories to get to. Thank you guys so much, and I hope you have a great day. Good morning and welcome to another segment in this episode entitled COVID as Tool to Disempower and to Take Away American Rights and Freedom. After releasing the first segment of this episode, where I revealed that my nephew, who was fully vaccinated, who has no compromised immune system, and who is healthy, got the COVID-19. And not only did he get COVID, but he also had the symptoms, all of the symptoms. Today, we are learning that New Jersey is going to be requiring mask mandate because first of all, just so you know, New Jersey is among the highest in the country in terms of vaccination rates. Okay, New Jersey. Yet there has been a rise in new COVID cases. Yet they are still pushing the narrative that people have to get vaccinated. I am going to tell you guys this right now. It is absolutely ridiculous, and I'm raising my voice here, and it is nonsensical. I mean, I want you guys to think about it clearly and expansively and logically. First of all, I'm reading a story this morning coming out of Austin. And the story is entitled 230 Unvaccinated People Hospitalized for COVID-19 in Austin area in 2 weeks, compared to 47 vaccinated. Compared to 47 vaccinated. The story says that roughly 80% of people hospitalized for COVID-19 in the Austin metro area in the past 2 weeks were unvaccinated. New numbers from Austin Public Health show. Stage 5 is coming to Austin, Travis County, but it looked different. On Tuesday, APH announced that 230 non-vaccinated people were hospitalized between July 19 and August 1 as cases locally and statewide surge. Fully vaccinated patients comprised only 16.55%. I'm talking about of the 230, presumably we said 230 unvaccinated people are hospitalized for COVID-19. On Tuesday, APH announced that 230 non-vaccinated people were hospitalized between July 19 and August 1 as cases locally and statewide surge. Fully vaccinated patients comprised 16.55%. 16.55% of the persons who are hospitalized. Remember that we're hearing that once you are fully vaccinated, okay, then it minimizes hospitalizations and the severity. Now I'm going to show how they are changing the language. Because we are being told, I read recently that if you are vaccinated and you get the symptoms that leads to hospitalization or death, it's because the drug is not effective, because it is if you take certain cholesterol drugs with cholesterol, what happens is that it cuts the efficacy to 73%, but it's still supposed to be efficacious because Johnson & Johnson is supposed to be 66% effective, yes? Then we hear that if you are older, 73 and older or 60 and older, or if you're immunocompromised, then that can also affect the efficacy. Yet, when the drugs was being rolled out, I may make a mistake to say drug instead of vaccine. When the vaccine was being rolled out, we were told that it only provides. We were told that they were going to roll it out among the oldest and persons who have compromised immune system. Compromised immune systems. However, now we are seeing that some older people are getting the virus and being hospitalized, some are leading to death. Now they're saying, well, further studies shows that is only happening because it's they're using cholesterol, probably they take cholesterol induced drugs or drugs that suppress the immune system, or they are older, they have immunocompromised system. So every time the drug loses its efficacy against a particular group that's supposed to be, where the drug's supposed to be effective, they come back with a research that says, oh, well, it's not supposed to help those persons. What if everybody in America was vaccinated? People will still be getting the drug, yes? I mean, the virus, the COVID virus. So what's the argument going to be now? So on Tuesday, APH announced that 230 non-vaccinated people were hospitalized. 16.55% or 47 of the total patients while partially vaccinated represented. Sorry, of this figure of the 230. No, it's not actually not the 200. But 230 non-vaccinated people were hospitalized. So, but we have 47 vaccinated people were hospitalized. Okay, and those who were partially vaccinated accounted for 2.46%. So the partially vaccinated accounted for 2.46%, and the fully vaccinated accounted for 16.55%. And then 80% were people who were not vaccinated. So 20% of the people who received some kind of dosage were affected. So whether or not, and then, the other thing you have to look at is exposures. The people who are not vaccinated, what's their exposure level in terms of, are they socially distancing themselves? Are they, that's one of the, are they socially distancing themselves? And were they wearing masks? And, okay, we have to also study their exposure. The people, the 80%. What about the 16.5%? What did they do differently? Their exposure and so on as well. And so on and so forth. So, however, we are hearing New Jersey is now, and now schools are thinking about getting mandates to vaccinate people. Mandates. Schools and so on are telling people that they will have to know that no, they're going to consider vaccine because because if you are vaccinated, it's a highway. That's what's spreading the disease. But we know that unvaccinated people also spread the disease, spread the virus. Whether or not you are vaccinated, you can spread the virus. Okay? But yet still, they are making policies telling people, forcing the non-vaccinated people who refuse to be vaccinated that they must be vaccinated. And then making comparison about if you get a tetanus shot and you can choose whether or not to do it. That is a nonsensical argument, and it does not rise to the level of what we are talking about. It makes no sense. You cannot and should not force people to be vaccinated if they don't want to. Because what the argument? Oh, because you you are less likely. Tell that to my nephew who was fit and healthy and never had no immunocompromised system and got the virus. He was vaccinated but still got COVID-19 and the symptoms, and people are still getting the disease. But yet still they're telling people that they have to withdraw from classes, and they're developing legislation. Is that American? Does that make sense, guys? No, listen to me. Let me ask you guys a question. And you cannot say because you are. It's like people are. It is as if you are having a conversation. What is the greatest sin? A sin is a sin. There's whether or not it is greater or not. It is a sin, and it takes you somewhere. Okay. Whether or not you get the vaccination, you are like. I'm telling you this now. Don't pretend. Don't feel as if you can walk out with confidence because you are vaccinated thinking that you will not be. Because guess what? In Austin, Texas, people who are vaccinated find themselves in hospitals. Okay? And while it may be... okay? And while we know that 80% of the people who are hospitalized are in Austin, Texas are vaccinated. We're going to pick up this story later. This is juicy. We're going to continue. Thank you so much.